Of all the issues that we deal with, the issue of abortion, the woman's right to choose, is among the most difficult that we face. For all of us who want to reduce the number of abortions that occur in this country, the best way that we can reduce the number of abortions in this country is frankly to support family planning and to make it available and to make it accessible. The women in this country who use contraceptives, I'm told 98% of them eventually will use them. Roughly over half of them use them for reasons that have nothing to do with not bearing children. But they use it it's a women's health issue. I want to make sure that they have access to that. Having said that, I'm not interested in us telling any church or the employees of a particular church what they can or can't do with respect to these policies. That's their decision. They're on their own. Having said that, if a woman wants access to these products, to contraceptive care, that she should be able to get it, not provided for by her employer, but literally provided for by the insurer. And the policy that we've actually agreed on here in this country is that the employer, if the employer has some reservations about providing these as part of their policy, they don't have to support it. The employer doesn't have to provide this. The woman would have, under the policy of this country, would have access to those products and those contraceptives, and provided for by as a policy with respect to their insurance coverage.
My opponent, Senator Carper, did not read the legislative language in Obamacare. We have that on video. That's a fact. If he had read the language, he would see that they were putting faith-based health service organizations in a bind. We have the First Amendment in the United States that guarantees freedom of religion. Some of my original ancestors came here for freedom of religion. That's not only a way to worship, but a way to live. There was a bill put forth before the U.S. Senate this past year reaffirming freedom of conscience, religious conscience in this country. And Senator Carper voted no on it. You can't have it both ways, Senator Carper. Either you believe in the First Amendment or you don't. Either you read the legislation before you vote on a bill, or you don't. But contraception should be available to anyone who can afford it. Contraception comes in 17 different styles. It's inexpensive. It's universally available to the poor through Title IX work. It's not the government's role to get itself, by mandate, involved in the intimate details of a man or a woman's reproductive life.
This is a very sensitive issue. It's an issue around which there's been quite a bit of discussion in the Congress and across the state and the country. And it arises because the Affordable Care Act has a certain minimum benefit package that includes contraception. And I think it's widely agreed that contraception is important health considerations for men and women, and it ought to be part of that minimum benefit package. The question gets to be, when it relates to a religious organization, that something like this violates a principle of that particular religion. And I don't believe the government, quite simply, I don't believe the government should compel any religious organization to do something that violates a religious tenet. The question gets, and the regulation, as I understand it, would not compel churches and direct religious organizations from doing that. The question gets to be with respect to institutions of higher education, hospitals, and the like. And again, if they are sponsored by that religious organization, I don't think they should be compelled by the government to do something that violates a religious tenet. I understand that there's a compromise, a workaround, if you will, to that issue with respect to some of those institutions, and I will continue to monitor that, to whether that makes sense or not.
I'm a Republican because I believe in a smaller, more effective government that's less intrusive in our lives. That means it's less intrusive into all aspects of our lives, all aspects. I don't believe that we should have the ability as a federal government to set a minimum benefit package, as is done in the legislation supported by Representative Carney, that requires those religious organizations that do not believe that it is appropriate under their tenets to provide contraception coverage. We are mandating as a federal government issues that violate our First Amendment right to freedom of religion. I think that also applies to the issue of marriage, which didn't come up. But I will say I'm a Republican, and I do not believe in a federal definition of marriage. Just because we don't like something doesn't mean that we should fall out of our basic tenets. We must have a smaller, more effective government that stays out of the social lives of our citizens. That means we should not be legislating the requirements of contraception coverage, and we should not be legislating what happens at the same time in churches defining marriage. That is between them and their religious organization. And I will apply that consistently and fairly among a number of topics.